As COVID-19 cases increase and flu season is approaching, some are concerned that both viruses will hammer Americans at the same time. But doctors say now is not the time to worry. Janelle Bluta connects the dots.
Public health experts and leaders are bracing for a worst-case scenario this winter, a flu outbreak in the middle of the coronavirus pandemic. But there is hope the viral tsunami won't happen. Let's connect the dots. It's a frightening scenario that health officials have been warning about since this pandemic went global, a second wave of coronavirus during the winter months, while we're already battling the flu. In the winter, conditions tend to be better for the transmission of viral diseases. Now, leaders like Texas Governor Greg Abbott are urging everyone to get a flu shot early so we can deal with one problem at a time. But there is some evidence that the flu won't be quite as bad this year. It's actually winter right now in Australia, thanks to the whole southern hemisphere thing. It reports a big decrease in hospitalizations for non-coronavirus infectious diseases. A top autoimmune disease expert told CBS that is thanks to all of our efforts to stop coronavirus. Between the mask wearing, the hand washing, and social distancing, we are actually stopping other viral outbreaks as well. But that doesn't mean we should not be worried about the flu. In fact, that same expert says we should all get flu shots this year. While coronavirus is proving more deadly, the flu still kills an estimated tens of thousands of people in the U.S. every year. Connecting the dots, I'm Janelle Bluta for H-Town Rush.
Janelle, thank you. For the latest on COVID-19, text the word FACTS to 713-526-1111 and we'll send you back with a link with more information.